Hi guys, this is Preeti here from Best Mom, which is a platform for pregnant women. And today we are discussing about morning sickness in pregnant women. So almost around 90% of pregnant women have experienced some kind of morning sickness throughout their pregnancy. It can range from mild to moderate. Around 0.5 to 2% of pregnant women experience more severe form of this morning sickness, which is also called as hyperemesis. And today we will be discussing more about what is this hyperemesis, what are the symptoms, and how should you deal with it. Morning sickness can start as early as by third week of pregnancy and generally tends to subside by end of first trimester or maximum by 14th to 16th week of pregnancy in most of the cases. In some rare cases, morning sickness can actually go throughout the pregnancy. Even though the exact reason of morning sickness is not known, some of the hormones like estrogen, progesterone, your stress hormone, these are some of the hormones which are held responsible for morning sickness. In some cases, the lower blood sugar levels tend to aggravate the symptoms of morning sickness. If your morning sickness symptoms like nausea, vomiting are not subsiding by end of third or fourth month and you are feeling extremely tired, you should definitely consult a doctor because you might be suffering from hyperemesis. Most of the symptoms of hyperemesis revolve around the fact that you have lost too much fluid during vomiting. So the symptoms include severe dehydration, the frequency of urination will decrease, your blood potassium level will decrease, you might be under a state of alkalosis, weight loss is happening, your blood pressure might be too low, you feel too much stressed, too much tired, face headache, and in some cases you might be suffering from jaundice as well. So if the condition is severe, you should seek for medical attention immediately. The fluid loss in your body needs to be replenished as soon as possible. Your doctor will prescribe some drugs which can suppress your nausea and vomiting sensation. This generally include antacids to subside the acid reflux or some antihistamines to decrease the symptoms of nausea and vomiting. If the fluid loss is too much, you might be hospitalized immediately just to replenish the fluid loss which has happened because of vomiting and the electrolytes which you have lost. You will be under infusions through IV or through injections. You should hydrate yourself. Remember that hyperemesis could be the severe form of morning sickness, but it is still curable and can be treated if you highlight to your physician on time. Morning sickness or hyperemesis in general will not affect your baby. The only risk is your baby being underweight at the time of birth. I hope it was useful. For any further questions, you can comment in the section below. You should definitely subscribe to our channel for more such videos. Thank you so much for watching.